What I would like patients to know about Florida Heart Associates is we are physician-owned. The person you're going to see when you come into that room, and one of the owners here, and we make the decisions. Therefore, we're able to make the decisions about patients' care that other physicians may not be able to be if they're in an employed position. Restrictions are put on those people about what they can do and when they can do it by people who aren't physicians. And the physicians here make the decisions. We are the owners. We decide what gets done here with our patients, not someone else. And we understand what this community needs. We believe we know where it's going. We're offering patients a choice in our community, and the fact that we're able to react very quickly to changes in this community, whereas perhaps larger entities are not able to do that, we believe that that's actually the future of this area and this practice. And we believe that we will serve the entirety of Southwest Florida with our current facilities and the growth plan that we have in mind. The Ambulatory Surgery Center gives the patient a different venue. I believe it gives them more personal experience. It's not the large box experience, if you will. It's a boutique, if you want to look at it that way. The patient loves it whenever you say, I ask them, how's your son doing? Last time you mentioned this about your son or your family member or your parent. They look on their face when you mention something about that, and they realize that, oh, he listened, he cared. Patient history is very important, right, because it gets us to where we are. Why is that patient here to begin with? In fact, one of the questions I'll usually ask that patient very first is, okay, why do you think you're here? What's been going on that brought you here? The earlier you do that, the better. The first time you meet with them, whether it's you sit on the side of their bed, whether it's you kick your feet up, things like that. You just have to set everybody at ease in the room first, because then they'll tell you things they wouldn't otherwise tell you. People usually don't come to a cardiologist very relaxed. So you have to, get them to just talk to you. I'm Dr. Kenneth Towe, a partner at Florida Heart Associates and medical director of the Heart and Vascular Ambulatory Surgery Center of Southwest Florida.